Well, good evening, everyone. My name's David Wilkins. I'm a third year resident at Texas Tech University Health Sciences Center. And this is our little presentation for you guys just to get to know the program. And please let me know if you have any questions or concerns. I know I didn't keep everything on here, but I tried to keep it kind of short and sweet. I guess to start talking about the program, we're very close, so it's very small. It's two people per class, so you get really close with your fellow residents. You can see in the top left, we go to each other's weddings, so it's pretty close knit. We like to do fun things together, just like all the other residencies, but we like to have fun. Because we are a small program, we're kind of just starting. We're going to have we have our first PGY4s now. I'm a PGY3. We don't have a lot of attendings, but I think we have a great core faculty. I know that we're working to get more right now, which is exciting. I'll just go through them real quick. On the far left, we have Dr. Roger Wolcott. He's our new program director. We have Dr. Bei Zhang. She's our assistant PD, and she's specialized in brain injury medicine. We have Dr. Christina Sanders, who's our pediatric physiatrist. And then we have Dr. Sabrina Tan, who just joined, which is really exciting, and she's general physiatry, and she's fantastic. Like I said, pretty small class. We're tight-knit, but this is our current residence. Not much to say. You can see we have a couple TTU HSC alums, so that's exciting. Good mix of MDs and DOs, so it's cool to see the different experiences with everybody, especially within the physiatry world. Believe it or not, Lubbock has water. That's Lake Allen Henry. It's not too far from Lubbock, so if you like nature, it's possible here. We're nice and close to New Mexico and the mountains there, so that's exciting too. And close to Colorado. I'm actually from Colorado, so it's nice to drive home, go skiing and stuff like that. Kind of like I said, the camaraderie is just big here. It's close. You have to be close with your other residents. Open discussions and feedback. Because it's small, we have a very close relationship with our attendings, which is really exciting. It doesn't feel like there's a lot of people all at once. You have a lot of time with your attendings. You're able to ask all the questions you want to ask, and I think it's good for learning. Another important thing, and I think something that led a lot of us to be here, is it is an underserved area. There's a really, really big need for PM&R here, and it's kind of shocking how many people need rehab and how many people are just waiting to get into the rehab hospital that's here. There's kind of always a wait list, and it's crazy. There's a lot of leadership opportunities because there's so few of us. Research opportunities. We're all doing QI projects right now, and teaching. We have lots of medical students that rotate through, and we enjoy teaching. Some simple basics, because when I was first applying, I didn't even know where Lubbock was, so it was nice to see where it is. It's basically as northwest can be besides Amarillo. It's basically a big college town. Texas Tech University is big here. About 250,000 people. Big benefit for me and what led me to this program is it's very, very affordable. And we'll kind of go over the salaries later, but it's great pricing. It's really easy to live here. There's no traffic. Just as an example, I live 2 minutes from our inpatient rehab and basically 5 to 10 minutes from every other place that will be. So I never have to worry about my commute, and it's always nice and easy. I actually ride my bike to the rehab unit. Lots of wineries. We have some people that like wine in the residency. So if you like wine, there's a lot of good grapes here. The goal of this program is basically to train the next generation of physiatrists to take care of people in this West Texas area. So whether that means New Mexico, Oklahoma, even Southern Colorado, there's just a huge need to train physiatrists and to practice in this area. A little bit more about Lubbock. We have a pretty cool place. It's called the Buddy Holly Center. You see the Lubbock Ballet and Symphony there. We go to shows there occasionally. My little daughter actually is learning ballet there, so that's pretty fun. As far as Texas Tech goes, it's a huge part of the city. You'll see on game days all the flags up, and people love it. I'm a Boulder fan, so it's hard for me to get behind it, but everybody else does. uh, there's another lake, Buffalo Springs Lake, and it's pretty good. There's nature trails. They do marathons there, and so there is some nature. Just keep that in mind. A little bit more about it. Lubbock is a big city, but in uh, a small place. It's separated from a lot of other places, so the sense of community is really, really strong here. You do feel like you belong. All your patients are really nice, really supportive. It makes taking care of people fun and easy. There's tons of restaurants. I heard a rumor that there's like more restaurants per people here than anywhere else in the US. I don't know if that's true, but you check it out. Um, we get concerts, comedians, theater, like I said before, at Buddy Holly, and then college sports. If you're a college fan or college football fan or basketball, this is a great place to be. And then cost of living again. I'll touch on that again really quick. I think this was basically the only place that I applied for residency that I'd be able to afford a house. So I'm lucky enough to have bought a house, and you can technically live in that house on this just the salary from your residency. So that was really exciting for me. Speaking of salary, here are some of the benefits. I think you'll find that the compensation is pretty good, especially when you take into the fact that Lubbock is such a cheap place to live, especially with commute times are very low, and housing market is very low here in terms of cost. Vacation and sick leave is pretty much standard. It's 15 working days for the ones and twos, and then no more than 20, not counting weekends. So this is like days that you're expected to be working. So it's basically the 4 weeks, which is pretty typical. Educational stipend, we get $2,500 over the course of the residency that you can use PGY 2 through 4 for conferences and things like that. I think you can get an additional 500 for research opportunities. I'm not 100% sure on that, but I think so. And then the health insurance is provided for each resident and dependent. So like my wife and I are on it, and our kids are on it. It's really good. We've unfortunately had to use it, and it's good. Low copays. So just quickly, you can kind of see all of our training sites. Like I said, they're all basically 10 minutes from wherever you decide to go in Lubbock or wherever you want to live, which is really nice. There's not too much to say. I guess Trust Point Rehab Hospital is our main inpatient rehab. That's actually the picture that you're looking at. It's a freestanding rehab hospital. It's pretty dang big. I think it can get up to 90 beds plus, which is pretty cool. And we just see tons and tons of different pathology. Kind of like I talked about earlier, we're sitting in Northwest Texas, but there's no big rehab or level 1 trauma centers except for here. So you see a big diversity in the patients that you'll take care of. We unfortunately, or fortunately for us in training, see a lot of spinal cord injuries, traumatic brain injuries, and strokes. That might just be part of living in Texas, kind of away from everything. But yeah, you can see what else we do. Veterans Affairs is really cool. We get to work at the VA and work with those patients. That is a really fun learning opportunity. We do a lot of procedures there, a lot of fun procedures, ultrasound guided stuff, intra-articular joint injections. Really enjoy that. Lubbock Spine Institute, we have a close association with, and we have some associate faculty there. So you get a lot of pain experience if you want it. And we actually have a fellowship here as well. So if you're into pain, that might be a good option for you. And then we do pretty good wound care. It's at the bottom, but we do rotations with them, and it's pretty cool to learn how to do it so we can use it while we're on the inpatient side and maybe not have to consult everything. General program structure. So our program's 4-year categorical. Uh, Intern year is broken up into the traditional 4-week blocks. You can see what it is, but we just increased. So it's a new program, so we're kind of changing things here and there. But we recently increased blocks to neurology, so you have this nice inpatient, outpatient with neurology, burn ICU, which is a really cool rotation. You'll do lots of surgeries if you want to, do lots of skin grafting. The orthopedics is a great experience for any intra-articular joint injection. I know that I did a couple hundred knees and shoulders while I was on that rotation, which seems crazy for just a month. Our pediatrics rotation, Pally, Jerry, internal medicine. Our internal medicine and our family medicine are mostly inpatient. So that's kind of your big inpatient block to learn medicine. We recently added psychiatry, so we'll see how that goes. And then at the very end, you'll end with a PM&R block as you kind of get started and ramped into your inpatient and PGY2. I didn't break them up specifically, but it looks pretty similar, PGY2 through 4. What changes is the amount of time that you're inpatient. So obviously, as you scale through 2, 3, and 4, you're going to spend less time inpatient, more time on outpatient or elective blocks, and that kind of keeps increasing per year. It's also something we're still kind of figuring out what's best for the residents, which is exciting because we have a big say in what we want to do and what we can do. And because we work closely with our attendings, they seem to listen to us, at least so far. So we'll remain hopeful. But you can see it pretty similar to everywhere. Electives, we have a lot of options for. I didn't have them put down, but pain is options, sports are options, research, actually some people are doing research. You can actually do additional wound care as an option, so that's exciting. The building that you're seeing is the Moody Center, or Moody Rehabilitation Center, and that's where we do our didactics. So we actually do a 4-hour block, so it's 8 a.m. to noon on Thursdays, which can seem pretty hefty, but I kind of like it that way. You kind of just you're ready to focus that morning, and you have 4 hours off of whatever rotation you're on, so that's not too bad. It's an 18-month kind of rotating cycle. So I know some programs do 12 months. We just do an 18-month, cover all the important topics, traumatic brain injury, spinal cord, all that sort of stuff. And it's just set up on that recurring cycle. And then we do 1 hour quarterly of just systems, admin, leadership, QI, wellness and resilience, which is important to us here, diversity, equity, and inclusion, and then research. And we'll have people come in and help us kind of delve into research topics and learn how to do that a little bit better. And then something that's new that's kind of exciting is we're getting regularly scheduled access to the anatomy lab and ultrasound training. So we're doing that through the university. We were actually just recently in the anatomy lab, and we're looking at cadavers and looking at, insertions and origins and talking through different muscles that we're going to Botox. And we do get some experience with training, having people come in, and we use like syringes with a dye in it, and we use ultrasound to inject, and then we look how close we were to the muscle and where in the muscle we injected. And I think that's really fun. And that's it. Pretty short and sweet presentation. If you have any questions, you can message our program coordinator. She can get you in contact with any of us. We're happy to talk about anything. And then follow us, I guess, on Twitter and Instagram. That'd be great. And I'm here if you have any questions at all. But we're just so happy that you guys are considering our program, and we're excited to keep growing and getting bigger.
Hi. Good job, David. I'm so proud of you.
Hi, Lexi.
What's up? So we've also got, so I'm Lexi. I'm a fourth year PGY4 or whatever I am. And we just wanted to like be on. We have Sonia on, and I believe we have Dr. Zhang on as well, just if y'all have any other questions, okay?
There is a question in the chat actually asking about minimum score requirement for step 2 and if you guys support J1 visas.
Thank you, Dr. Z.
I was like, that's a Dr. Z question. Perfect. Thank you, Dr. Zhang.
So we still have a couple minutes left. Oops, we still have a couple minutes left from the 20 minutes, but I know we have gone a few minutes over the dedicated time, but would you guys like to share your contact information in the chat that if any of the attendees have questions, they can reach out to? Awesome. Thank you.
Yeah, feel free to email or any questions at all. Oh, okay, we have a question. I think like we can go over the obvious ones, like be on time, participate well. We just like to see someone who's truly interested in physiatry, seeing people get better, paying attention, learning on rounds, maybe presenting ideas and thoughts and just being engaged when you're rotating. I think that's got to be the most important stuff, unless anyone else has thoughts.
Yeah, I totally agree with David. I think that was really well said. I also think like we're not necessarily looking for someone that already knows everything, but someone that's excited to learn and that's like willing to like be brave and look stupid to learn, you know?
Yep. We all have a lot to learn, so it's okay to ask those questions and yeah, just have fun with it. Like we're all here just because we love physiatry, right? So just ask all the questions you have and just participate, enjoy it. Yeah.
Yeah.
And you guys have about 2 minutes remaining.
That's it. Bye-bye.
There's a
Okay. Yeah, I see it. I see it. So how would you describe the program's culture? Well, I mean, we have international student with us. Maybe she can speak on it. Dr. Mejia, if you're here.
Hi, yes, I'm here. I'm a PGY too, and I feel like it's very inclusive. I am from El Salvador. I graduated in med school there, and I really like here. And like even though it's a new program, like I feel like we're learning a lot, and I feel like they take in consideration everyone. And like Dr. C was also at IMG, so we know the struggle and we know how hard it is for people from other countries.
Yeah, we consider everybody. There's no there'd be no reason for us not to consider any IMG that's applying. So if that helps, does that answer your question, or were you asking a different question? Okay.
Awesome. And with that, that actually marks the end of the VRF session tonight. Thank you so much for your time and a wonderful presentation. And thank you so much to all of our attendees who took time out of your busy schedule and the programs to be here.